When it comes to the difference between men and women, there's no accounting for taste, but you can account for smell. According to abcnews.com, there are often pronounced differences in the ways men and women perceive smells, sounds, and sights. There are fewer differences between men's and women's senses of taste and touch, but in general, men underperform compared to women in the sensory department. Men are more likely to suffer hearing loss, and they have a less developed sense of smell. According to a study from Johns Hopkins University, men are 5.5 times more likely than women to experience hearing loss as they age, starting as young as 20 years old. We spoke with the audiology specialist at Lake Ear, Nose, Throat, and Facial Plastic Surgery about the warning signs of hearing loss.
Some of the first symptoms of hearing loss would be ringing in the ears. Ringing in the ears, what we call tinnitus, is something that is a symptom of damage to the hearing nerve. Symptoms of damage to the hearing nerve are tinnitus and hearing loss, and the two of them usually go together. So many people will come in and say, my ears are ringing, and one of the first things we will do is test the hearing, because we want to determine, is there some damage or degeneration of the hearing nerve that can be associated with that ringing.
So with age-related hearing loss, you'll start to feel like you just have a muffled sound quality. Typically people say, it sounds like I have cotton in my ears, and they think they have wax in their ears or something like that because it just sounds muffled. And then you'll just start to notice the signs of not, enjoying conversations, that type of thing. You just come in for a baseline, we'll see where you're at, and then we can give you recommendations from there.
One of the first things that we start to see are family members, significant others will start to notice that you're missing out on conversation. And they will usually begin to suggest that. And sometimes that's taken very easily, sometimes it's not. It's a little bit of a touchy subject, but we do recommend that people come in just to have a screening. And we will be honest and let you know if you're in the area where we need to start considering amplification or not. And sometimes when we tell you what you're missing and help you understand that you're not completely deaf, there's not a huge problem, but we also understand why you're missing out a little bit, then it breaks the ice a little bit better.
We always tell people, just stop and look at your surroundings. How often am I having to ask people to repeat themselves, or how often am I not hearing it so I don't answer? Those are kind of the signs that maybe you need to start getting a hearing test so we can see where you're at.
For appointments and more information about hearing aid and audiology services offered at Lake Ear, Nose, Throat, and Facial Plastic Surgery, click the Male Hearing Loss story link on our homepage, yourhometownhealth.com.